I'm James from class. Um, we're going to go over emotionally focused couples therapy. Um, EFCT is an integrative attachment based approach to couples therapy. It's both experiential and brings in systemic theory to understand attachment needs. The process guides couples through a simple structure that goes deeper into the emotions. The couple goes through exercises to create a stronger emotional bond through attentiveness, and in this way, they build the foundation for a secure attachment. So there's different components: experiential and systemic. Um, so here's the experiential part. Um, the Therapeutic Alliance offers a safe haven where emotion can be at the very least tolerated and then reflected on. And the therapist must create a secure base um, so that the couple can explore from that base and expand their experience. The therapy requires an active commitment to validating um, the couple's experience, their experiences internally and externally. The acceptance allows for the safety for each partner to complete their self healing and growth in therapy inside and outside of it. Safety needs to be fostered by authenticity and transparency of the therapist. There's the assumption that human beings have the ability to make creative and healthy choices given an opportunity, to feel authentic and safe. As therapists, we have to be non pathologizing. The therapist will encourage the couple to examine their own and each other's inner and outer realities. Um, our inner construction of experience results in our interactional responses and patterns in the system. Since we're all formed and transformed by our relationships with others, as an EFT therapist, you have to reshape a sense of who the couple is by changing the patterns of their relationship. And then lastly here, the EFCT fosters new corrective experiences in the here and now of therapy, and the therapist tracks the couple's encounter and guides the expansion of their understanding of each other's world. So systemically, causality is being circular, recursive, all those fun words we used in our theories course. So the behavior of one person of the couple is considered in the context of their partner. Systems elements, they're predictable and consistent because it's all just kind of the one system. So the system always wants to maintain homeostasis, and that's the easiest way so that the cycles of interaction, they repeat and they're regular. All behavior has a communicative aspect. The roles of people are defined by how they communicate. Content messages reflect the nature of the relationship that the couple has. So the levels of communication conflict, like when we see an apology that really just looks passive aggressive. The therapist's role is to interrupt the repetitive, inefficient, or problematic cycles. The new patterns should be more flexible and free. So here's the attachment theory components of EFCT. Evolution's made us seek and maintain contact with significant others, and therefore it is an innate survival mechanism to seek and maintain that contact. Relationship dependency is normal, and it's necessary for our human and mental and physical health. Our connection with key others provides a safe haven and protection from danger. Our attachment relationships are a secure base to explore inner and outer worlds, and the relationships promote growth and autonomy, which might sound kind of counterintuitive, but if you see an attachment relationship as that secure base, it makes sense. Accessibility and responsiveness to each other foster the secure attachment bonds that are our base. When we experience fear, illness, and stress, these activate our attachment needs. Collaboration's more likely with secure attachment, so we can solve these problems and alleviate our distresses. If partners are not secure, they have difficulty attending to each other's emotions, and it's even more difficult in moments of stress. Separation distress normally results in trying to be close to the other. The distress occurs when a key attachment figure can't be reached or doesn't know how to respond when an emotional need arises, or just plain doesn't respond. Emotional needs can simply come from basic practical needs, just in case I'm not being clear there. The views of ourselves and others create inner working models of attachment, and these models map how we can navigate our relationships based on prior experiences in relationships in general or specifically with a certain person. Each relationship can be relatively secure or insecure. So the practice of EFCT, we need that collaborative alliance. Emotions an underpinning of our experience and therefore our perception of experiences. Our partner's attachment needs and desires are seen as healthy and adaptive. Since our outward appearance and interactions are reciprocal, the therapist first de-escalates negative interaction patterns and the reactive emotions in the reinforcing feedback loop. Then we need to help the partners create new cycles of positive interaction where positive emotions are supported and negative emotions can be regulated in ways that support a safe emotional connection. The attachment bond is supported and enhanced by the new improved emotional experience. Attachment perspective. The attachment perspective on love provides the required essential elements of the relationships, and as EFCT therapists, we want to create a new cycle of more secure relationship bonding. So there's three primary tasks in EFCT. Of course, create the therapeutic alliance. That's so common in so many therapies. Then we want to go through exercises that go through the problem that the couple identifies to be able to understand the problematic emotional responses. We do that by identifying them, encouraging their expression, and then restructuring their experience of those emotions by deepening and asking evocative and reflective questions about these emotions and how they came about. Lastly, we as therapists restructure the interactions. We track the negative cycle. Then we use reframing and choreograph new relationship responses and events. We reframe problems in terms of cycles and attachment needs and fears of each partner. We might likely ask a partner to share what specific fears they have with the other partner, and that should create better dialogue for a better, more soft, tender interaction. So the typical session is going to involve, it's going to have 5 steps that build in intensity as you cycle through them. First, we reflect the present process that we observe. The second step is to deepen the level of engagement of, in that process to explore the emotional experience. Third, we do the enactment and expand on the experience that's communicated to the partner, so each of them knows more about the fundamentals of why the emotion's there and how deep it feels for each partner. Fourth, we process the enactment. We ask both partners to share what it was like to hear the messages from the other and themselves and express new feelings given the different sense of the situation and the emotional depth and understanding that's created. Negative responses will be contained and explored. And fifth, we integrate and validate by reviewing what just occurred, so the understanding of the new reaction can deepen and be more cemented, so it can have a better lasting effect. And of course, you praise them for their accomplishments in therapy and outside. Another way to look at it is you can see 9 treatment steps in 3 stages. The first stage being cycle de-escalation. So the first step in that de-escalation is where you identify the relational conflicts with the couple. Then you identify the negative interaction cycle and describe it. Step 2, you acknowledge the unacknowledged attachment attachment-oriented emotions of each partner. On the last step of de-escalation would be to reframe the problem, understanding that it is a cycle, and having been able to see the underlying emotions and understand each partner's attachment vulnerabilities and needs that brought up those emotions. Stage one creates like a partner meta perspective on their interactions. They're usually unconscious of a lot of the reasons they're having the negative cycle, so this brings it out more into the open for them to see more fundamentally what's going on. Stage two. The goal of stage two is see these withdrawn partners re-engage and state terms of their re-engagement, their interactional patterns. In other words, we get the partners to identify better with the attachment needs that have been disowned, as well as aspects of themselves. Then the partners can accept the other's experience through mutual dialogue. In step 7, they express their needs and wants, and that's reinforcing their attachment. So in that way, the partners should be basically mutually accessible to each other and responsive to each other. In stage 3, you're just consolidating how those new responses are, the cycles of interaction by reviewing accomplishments of the partners. Step 8 is to collaboratively create new solutions with the couple to their old problems. And lastly, step 9, there we go, is to review their new positions with regards to each other and how this new cycle helps create a more secure attachment bond. So the book states that the obstacles in EFCT therapy would most likely occur in stage 2, where you're trying to take out the blame that each partner's tends to assign to each other, and they place fault on each other. So there's probably a lot of historical hurt there, so you might need to address that in individual sessions when you notice that you can't get any further. This would allow the partner to ideally feel as safe as possible with you as a therapist. If it looks like therapy will move forward, the person will be able to address how hopeless they feel with regards to their partner's ability to meet their attachment needs, or maybe they just have a history of not having their attachment needs met. Another thing is these attachments can also trigger like big feelings with regards to their past emotional responses, and they have to be supported, and each partner needs to be humble and powerfully approach each other and support each other through understanding of each other's vulnerabilities. They have to have a vision for themselves and each other so that they may be able to be able to respond to each other in reassuring ways and take some brave steps to support the other as they see the pain of the other person's emotions. So there's like the attachment, injury, and resolution model. So that's kind of what we're going to in this slide. The injured partner describes the impact of the injury and how it affects their relationship. The other partner needs to hear and understand them and be able to ascertain their responsibility and express that, as well as show remorse so that the other partner can accept the injuring partner's new understanding of their perspective. Then the injured partner asks for what they need as a result of their emotions and the events that just happened. So as long as they're able to meet each other's needs or be able to work towards that, they now have a new narrative of what happened, understanding that they understand each other better and want to attend to each other's needs. So EFCT basically applies in so many situations with couples, and it helps build their resilience. It's been shown to have an impact with many different ethnic backgrounds. It's able to assist relationships where there's a lot of mental health challenges, including depression, anxiety, trauma, addiction. It's worked for couples with diverse sexualities. Couples facing health problems have also been assisted by EFCT, and it's also apparently effective for trauma and PTSD. So you might not want to practice EFCT for these 4 potential contraindications on the right. As far as domestic violence, you need to ensure that there's enough trust to be able to go through EFCT. So 1 or more partners may need to go through a domestic violence prevention program. It also needs to be understood that certain triggers of domestic violence need to be identified, like collaboratively with couples so that they're aware. If you're going through EFCT of those triggers, and you might be able to stop the process or put it on pause or reduce the emotion so you can carry on. But if the violence is part of what's called intimate terrorism, where the violence is part of a power structure within the couple, EFCT would not be appropriate. So infidelity is defined by the couple, and so that would be a trust issue. So if infidelity, as the couple defines it, is actually occurring, then EFCT wouldn't be appropriate. As far as couples that are considering divorce to be on the table, they need the therapist first to help clarify their needs and their goals. And if these goals are congruent to going through the process and working things out to stay together, then they can go through the EFCT process. If they determine through the needs and goals process that they don't want to continue with the relationship, then of course EFCT would be appropriate to try. So yeah, empirically, effectiveness has shown significantly positive outcomes in as few as 10 to 20 sessions. There's a sizable body of research as cited by the text in support of the effectiveness of EFCT, and a significant number is that 70 to 75% couples that are treated with EFCT report they're no longer being distressed by the end of therapy. So I hope you can kind of see that's a little primer on EFCT, emotionally focused couples therapy. Appreciate your time. Good luck with the rest of your day.